Why'd you come up with the name Shift? I always have to take a breath because I always feel like, all right, it's a long answer. The simplest answer for me is that we want to shift or change healthcare. I want to create a company that is an agent of change for the 21st century.
All right, so we're going to start on the right side just to see what normal is for you.
We're a large office. We've been around for 15 years. We are affiliated with NYU, Hospital for Joint Diseases, Hospital for Special Surgery. We are a mainstream traditional physical therapy, very skillful orthopedic setting. And what I want to add to that is the piece that's missing. When people are injured, I think of it as an opportunity for them to look inward, look at their lives. And the question you're sort of asking is, do I need to shift my perspective or shift something in my life? Can I be more on the path that I'm meant to be on? I guess it was 2 or 3 years ago I had prostate cancer. I had a fantastic surgeon at Sloan Kettering. Surgery went smoothly and I don't have any risk for it. But what did happen that was very important that led to the shift was my wife recommended that I see an acupuncturist. Over a 2-year period I went every week and it was transformative. It was amazing. And I became very sensitive to energy. Acupuncture deals with energy meridians. I could feel the change in my energy day to day. And one day I went back to my office and I looked in this large gym. There's 10 physical therapists there, massage therapists, occupational therapists. And everyone's like stretching and range of motion and doing exercises. And that was always kind of cool. But I'm looking and I'm thinking, we don't even see or deal with energy whatsoever. I think it would be kind of miraculous to go to physical therapy and have someone there where you felt safe and they were vetted and the person was able to co-treat you with acupuncture, with your physical therapist, and use essential oils, and you do energy work or whatever. I want to have a truly integrative office. What does that mean? In a truly integrative setting, it's all happening at the same time. And that, I think, has never been done before.
You're treating the body physically, but there's a person there. I don't think that there's any physical therapy practice that is doing what you're doing. This is really a unique vision, and I think you're succeeding at it. It's really great.
The other thing we did, a similar approach, was with Donna Karen's Urban Zen Integrative Therapist, which they refer to as USITs. They do restorative yoga, they use essential oils, they do mindfulness. Reiki is a big component of it.
This is all about shifting out of the head.
Yes.
Doing the energy work. It's really just helping to calm our minds.
A lot of times due to the stress of an injury and going to the doctor and all the stress of your life, you're in a fight or flight state. All of the attention of the nervous system and the muscular system is focused on getting away, fighting or running away. That is not the state to be in for healing.
It makes everybody, the practitioners and the clients, everybody in the room starts to feel like, hey, this is about the big picture, and we do need to consider that.
It's only going to work if we truly collaborate and work together, and it's a team approach. We first collaborate with the patient. The team includes the patient. The patient is the center of the team. In the program that I'm in narrative medicine at Columbia, the premise is that doctors, physical therapists are scientifically trained very well. But going to the doctor, the experience of going to the doctor and the doctor working with a patient is not all science. There's a human interaction there.
If we just focus on the physical being, we're really depriving ourselves.
We're integrating all these approaches. We're collaborating as a team together, and the team includes the patient. The patient is the center of the team, and that part is the narrative part, the story. And the story, the humanity of it all, is really what's gotten lost in medicine in general. Creating this model has been a process. It's been an enjoyable process, but it takes time. And when it's all done and everyone thinks the same way, it's going to seem like, why was that a big deal? Patients want it and they deserve it, and that's why it's going to work.